Good morning, everybody. Myself is Professor Dr. Deshpande. We are in the Ayurveda College, Nigdi, Pradhikaran, Pune 44. With me are the PG students of Ayurveda who are doing the MD in Ayurveda. And today is a Monday, that is 6th of August 2018. And today's topic will be Ayurvedic treatment for constipation or Malavastambha. Ayurvedic treatment for constipation or Malavastambha. When somebody hears this particular topic, some may make a fun of it. So there are so many complicated problems like cancer is there, Alzheimer is there, Parkinson is there. And what simple foolish thing you are discussing. But they don't understand how much is the importance of getting the stool every day morning. That is a parama sukha in Marathi. It's an extreme delightful condition in our life. Those who are suffering from the constipation, they can only understand my statement. There is another philosophy. When everything goes on very well, we don't understand the importance of that particular thing. Some another simple things you can take it again. When we are routinely seeing so many nice things with our eyes, with our bright lights, with our powerful eyes, we don't have the importance of eyes. But by chance, if there is an accident on the Diwali festival and something is going into the eye and your eye has been lost, at that time we understand, oh, I have lost such a... And we cry, literally we cry. When we get the heart attack, then we understand the importance of heart. Routinely, heart is working non-stop, 24 multiplied by 7 multiplied by 365 from birth to death. But are you very much aware of that fact? No, we are not. Do we have the value of that heart? If you have the value of the heart, tell me what you are doing for the heart. No, really no. What we are doing nothing for our heart in a conscious mind. For example, if you have the value of some particular god, it may be Sai Baba, Ram, Ganesh, Muhammad Paigambar, Yeshu Christ. What you do? You go to the temple, you go to the church, you go to the Gurudwara, you worship. When you have the value for your mother, we give the respect to the mother, we follow her commands. If we have the value for the father, so every time we do something to show our value. For example, you have the value for Dr. Deshpande. So you are coming for the lecture, saying that yes, we have the value for your teachings. But what we are doing for our different organs that are playing the different roles. Heart is for circulation, brain is for your nerve control, kidney is for excretion, abdomen is for your digestion. How much care you are doing is a big question mark. We are not bothering of your body. In spiritual language, it is said, it is mentioned that human body is priceless, is beyond the price, is beyond the crore rupees. Crore rupees. It cannot be counted in rupees. It is far bigger than the diamond. Because if you count one by one, from brain to your foot, suppose I lost my eyes, how much I want to some transplant, retinal transplant. I want to do the liver transplant. I want to do the heart transplant. I want to do the kidney transplant. How much will it cost? If I lost my right hand, I have to fix the another hand. So much price, if you calculate all this, your damages to the different organs, it is beyond your imagination. And still paying that cost, originality is lost. Originality is lost. You cannot be a perfect human being as God sent on the earth. Do you understand? And what is the meaning of this all introduction? You will say, sir, you are teaching constipation and why you are talking philosophy? Philosophy is that way because in ICU, in NICU, you have the importance of different important body organs like heart and liver and kidney, brain and etc. But when I am talking about general practice, when I am talking about the general health of the person, is not really depend on the direct functioning of the brain. Even simple constipation can disturb your day-to-day life. Write down this statement and check it out for your patient. From your own experience, if I do not go to the toilet for 3 days and I am starting like full bulging of the abdomen and gas, how you can learn? How you can practice? How you can enjoy with your wife and family? No. You are always irritated. You are always depressed. And then you visit to the doctor and say, no, doctor, please do something that I should get a good stool. I should be relieved. Like urine, you are also bothering about the stools. Defecation. Defecation is such a normal procedure. When it is going on well, we don't bother. But when we suffer, then we say, do whatever you want, doctor. But please give me something. I should get satisfaction. Why satisfaction? You are not satisfied. That satisfaction is always depend on your good morning. I am always saying, when we say to each other, good morning sir, good morning madam, good morning student. So you must ask whether really my morning was good or not. That's a very interesting question. And when I give this type of lecture to the German people, American people, they always admire this lecture. They admire my lecture more than cancer about this constipation. Try to understand. Europeans are similarly bothered. They are worried about cancer, but they are more worried about constipation problem. Indians, they don't have the value of this constipation. But Europeans, they have the much value of constipation. Because they are suffering. They are getting the problems. They are irritated. They are anxious. And they say, doctor, tell us something good Ayurvedic. We don't have the proper medicine in allopathy. You give some basic philosophy causes of this particular problem. You know that a simple cause, yet even all medical fraternity has not understood. And very less research has been done for the simplest topic. My research topic is that take the 100 cases of Indian toilets and the nature of the defecation, and then you take the 100 foreign toilets, foreign type of toilets, what we call it as a commode. So Indian style and the foreign commode, and then make a comparison, which is the best to give you the proper stools. So in Indian toilets, regarding the Indian toilets, when we sit in Indian toilets for the defecation, it's the most ideal position because you get the pressure on the abdomen with your natural thighs. And so thigh pressure on the abdominal muscles make a natural peristaltic movements and a force for the sigmoid and rectal thing. But when you sit in the commode, there is absolutely no pressure. And so this natural physiological activity don't take place, and that's why according to personal my judgment, which should be proved by the scientific fraternity, that toilets in Indian style toilets are much more better than the commode system. This is my hypothesis, H0 and H1. So somebody should prove that whether the commode are better than the Indian toilets or Indian toilets are better than the commode. This is my research topic. But some foreigners have agreed that of course because of their old tradition, they cannot change immediately in one day. But rather we are following the faulty European things. For example, in our recent developed 5-star hotels, they don't have the Indian toilets. They are all the things there were commode. And nobody is bothering about that. Then they give excuses. No, for old people it is better. Rather it is more comfortable for sitting. But ideally, if you consider the physiological aspect of the large intestine and the anus and rectum, this region, there should be natural physiological pressure from upside, which you can get only in the Indian toilets. So this is concerned with the constipation problem, and this is one of the reasons that the foreigners, they don't get the regular, everyday, normal banana type. In the olden physiology and medicine books, they have described what should be the stool, how should be the stool. Ripe banana appearance. Without any straining, it should come like a mass formed stool. Either we get like a fluid or we get a hard. We don't get a smooth, lubricated, normal banana type appearance. But it is a very interesting phrase. In the olden days, our teachers used to use this phrase. If your regular stool in the morning is without defecation, at proper time, comes like a ripe banana, then it's fantastic stool. So if you have to describe what is fantastic stool, this should be the proper time, without staining and ripe banana appearance. These are the qualities. Okay. Another thing important is, actually in the human being only suffers from this constipation problem. If you consider the animal kingdom, very less animals, they suffer from this type of the constipation. This is very also interesting problem. Interesting rather the thought. Second important, interesting, is all theoretical, but Malavastambha, this word, has not really mentioned by Charak, Sushruta and Vagbhat. There is no reference of this particular word. The symptoms, clinical features are mentioned, anaha and atop, but specific Malavastambha as word is not been there. But in the practice you get a lot of people who are complaining of constipation. Next, there are basically two types of the constipation. One is acute and second is a chronic. But when Ayurveda talks about Malavastambha, it is basically of chronic nature. Only on a single day or few days, like 1 or 2 days, if you are having a hard stool, that cannot be immediately labeled as a Malavastambha. Remember the difference. But of course, that can be few days duration. That can be the acute constipation according to the modern medicine. And what is the reason for acute constipation of the 3 days, 4 days, 1 week duration? Anybody has an idea what is the? There are 3 categories. Number 1, if there is a pain at the anorectal region, if there is a pain, it is a constriction of the local musculature. Due to the fear, due to the pain, the patient tried to hold his peristaltic movement voluntarily, holds the muscles, tight muscles are there, and it is very difficult to get the normal stools. And what are the painful conditions? Very important are 2. Number 1, fissure in ano, and number 2, perianal abscess. Fissure in ano and perianal abscess because of the pain, because of the fear of the pain, the patient holds his movements of peristalsis, holds the muscles, and that makes the problem for getting the normal stools. Second thing you must remember, when your fecal matter, because of the non-peristaltic movements, because of the holding of the muscles, if fecal matter remains in the large intestine, that means there are 3 parts, ascending, transverse colon and descending. And then it comes to the sigmoid colon, then it comes to the rectum, and then comes into the anus. This is anatomical understanding should be very clear. Large intestine is divided into it starts from the ileocecal junction. Up to the ileocecal junction, it is small intestine. Then ascending colon, transverse colon, descending colon, sigmoid colon, rectum and anus hole. Am I right? First, stool formation takes place at ascending, transverse and descending colon. What is the function of large intestine? Absorption of water, and then the solid stool is formed. Why I am telling you this thing? When the fecal matter remains in the large intestine more times, what will happen? More and more and more water will be absorbed. So if you are holding, I have the sensation to go to the toilet, but I have made the habit to hold it, Vegavadharana in Ayurveda. So what is the pathophysiology of Vegavadharana in defecation? This is MD question, post-graduation question. What is happening if you hold the stool? What is happening? That matter remains either in the sigmoid colon, either in the descending colon, either in the transverse colon. Fecal matter, kitta bhag, according to Ayurveda. It contains both solid and liquid. So more and more water will be absorbed, and what will happen? Fecal matter will be more and more dry. If you are sucking action, if you are taken out the water, what remains? Hard matter will remain, and that is nothing but the constipation. Grathita, Ayurvedic word is grathita mala pravrutti. It is like a stone, hard stone. So, first point, it is very clear, acute constipation reason, because whenever we understand the treatment part, remember my words, I have given all my students, always giving the 6-step plan of treating any disease as per Ayurveda. Professor Dr. Deshpande has given always 6-step plan for treating any disease according to Ayurveda. First, Sankshepatah Kriya Yogo Nidana Parivarjanam. You must try to avoid, try to cure all causes. Nidan means cause, etiological factors. First you remove the etiological factor. This is first step. That means here, if you want to treat constipation, what you should do? Laxative of no use. You treat perianal abscess. You treat fissure. Naturally his tendency will go and then he will automatically get the normal stool. That means there your laxative will be supportive, not the main treatment. What you have to do? Nidana Parivarjan. Remove the cause, treat the abscess, treat the fissure, and then also give the laxative. Is it clear? Second step, I have said Pathya. In the diet, in the lifestyle, he should be very perfect. Third step, I have said Shodhana. If it is necessary, Vamana Virechana Basti Rakta Mokshanasya, whichever applicable. Of course, in constipation, only Basti can be applicable. I am not saying Vaman, I am not saying Virechan, I am not saying Nasya. I am not saying Rakta Mokshan, I am saying Basti. Fourth step, what is fourth step? Stamana Chikitsa. After Shodhan, Shamana should be there. Medicines, Kadha, decoction, powders, you give whatever applicable. Fifth, surgery if necessary. SOS, as and when necessary. For example, fissure, if you cannot treat, refer to the anorectal surgeon. Perianal abscess, incision and drainage, refer to the surgeon. Why? Ayurveda says, Tatra Dhanvantaryanam Adhikaraha. This is not physician's job, this is surgeon's job. In Sanskrit, Tatra Dhanvantaryanam Adhikaraha. And last stage, Rasayana Chikitsa or Apunarbhava Chikitsa. You don't want constipation to happen again and again. Then you must give some mild laxative for his lifetime. For example, Triphala tablet. Triphala is itself is a rasayan. It is not only laxative, it is rasayan. So for the old people, if you ask to take at night 1 cup of milk, warm milk, with 2 spoons of ghee, cow's fresh ghee, every day, that is rasayana for constipation. It can be taken for whole life. Whole life. Apunarbhava chikitsa. You will not get again constipation if you follow some basic things. So this is 6-step program. Coming back, we are talking about acute constipation. Second reason, there is no pain at the anus but still constipation for few days. That is idiopathic functional constipation. Idiopathic functional constipation. Idiopathic means there is no specific reason. Simple thing I give you, you have to ask very careful history. Sometimes especially first year students, for example, when you admit in the medical course or any course, education purpose, the people travel from their own place to the different place. And when they change the place, it is because of the change of the water, change of the food, change of the environment. There is a change in your physiology also. But that remains for few days, and after adaptation, it goes. For example, I travel. For me, fortunately, I never suffered from this type of problem when I traveled 20 years to the America or the Europe. But it is very common. It's called a jet lag. Your sleep rhythm changes when you travel to the America. 24 hours you are traveling from Pune to the USA. Especially West Coast I am talking about. So this is a change of place. Thus all physiological normal functioning are disturbed and you suffer from there is loss of appetite also. There is also little bit gas in the stomach. There may be constipation. There may be body ache. There may be little bit fever. No problem. After 3 to 4 days, acclimatization, that means getting accustomed to the change environment, these problem automatically solves. There is no pain in the perianal region. There is no problem. This is idiopathic functional constipation. Third point is very, very important for acute constipation, and that is called as a serious or the warning symptoms. General practitioner, if he don't know, if Ayurvedic Vaidya don't know this reason, he may land into the problem of medico-legal sue in the court. So this third cause is very, very IMP. Acute constipation, what is the serious reason? Can anybody knows immediately? Immediate idea? Serious reason for constipation. Life-threatening problem can be there. Yes. So we will make a list. Number 1 is intestinal obstruction. Intestinal obstruction, which can be seen as a hyperperistalsis by inspection, by auscultation. Hyperperistalsis normal is 4 per minute. What is the normal rate of peristaltic movements in the intestine? 4 peristalsis in 1 minute. This is normal. So this patient can suffer from hyperperistalsis, intestinal obstruction. Then paralytic ileus. Paralytic ileus is totally opposite. There is absolutely stopping of peristalsis. Stopping of peristalsis. So there will be no peristalsis, especially post-operative period, for 24 hours, 48 hours, for complication like fibrosis, stricture. What I am saying? Paralytic ileus, or like a shock, neurological problem. Paralytic ileus. And that's why in the hospitals, in the OT, surgeon and their assistants, they do the one question always in the post-operative patients. Patientला संडासला झाली का? वात सरला का? Is there any flatus? Is the patient has passes the stools? This is very important question post-operative. This is this paralytic ileus. This is acute constipation. Is it clear? And third important is called as a acute abdomen. Is not acute. Reason of the acute constipation is acute abdomen, and acute abdomen is called as surgical abdomen. Acute abdomen is called as a surgical abdomen. Why? Because these are the cases should be treated by surgeon and not by physician. Tatra dhanvantaryanam adhikara. Refer it immediately. What is the duty of general practitioner? To diagnose. What is the duty of Vaidya? To diagnose. It is not expected he should treat it. 3 important problems in acute abdomen. Number 1, intussusception. Intussusception in English, आतडी एकमेकात घुसतात in Marathi. Intestinal parts enter into lumen of the another. Intussusception. Moving one part of the intestine into the another part. Inside. Intussusception. घुसणे. Second, volvulus. VOLVU. Volvulus. मराठीमध्ये पीळ पडणे. पीळ पडणे. Like you wetting cloth when you make a twist and squeezing. It's like a squeezing into susception. Like a ladies, what you do in the वेणी, तुम्ही वेणी कशी घालता ती तसे येते. पीळ पडतो. आतड्याला पीळ पडतो. In English, volvulus. So first reason, intussusception, घुसणे, volvulus, पीळ पडणे. Third reason for acute abdomen, भोक पडणे, perforation. So never forget these 3 words. Intussusception, volvulus and perforation. Intussusception, volvulus and perforation can give you absolute constipation. This is not my word, huh? This is given in the medicine. That constipation is not called as a constipation. It is called as a absolute constipation. Since last 3 days, this young chap has not passed any stool, no flatus. His abdomen is full. We go to examine him. When we touch his abdomen, he shouted, he cried, oh, no. Severe tenderness, clinically. Severe tenderness. Then, board-like rigidity. These are very important words. त्याचं पोट एकदम कडक लागतं तुम्हाला, कडक. You cannot press the abdomen muscles. तुम्हाला प्रेस करता येत नाहीत. कडक लागतं पोट. त्याला म्हणतात, it is called as a board-like rigidity. So because of these two things, one is because of three things: history, 3 days absolute constipation, pain in abdomen, tenderness, and board-like rigidity. Immediately ask for X-ray or sonograph, immediate, and you will get the 100% result. And simultaneously, through the X-ray, he should admit into the hospital directly. It is not our case. Many times in this acute abdomen, in addition to the constipation, there is vomiting also. There is vomiting also. Remember these words. And this acute abdomen is not in our hand. It is not the Vaidya's duty to treat these cases. They should be referred to the surgeon. I hope I have given you the 3 basic reasons for acute abdomen. Acute abdomen with pain at the perineal region. Number 2, idiopathic acute abdomen or constipation. Idiopathic constipation. And third reason is a acute abdomen. Now we will talk about the chronic constipation, which is described in large into the Ayurvedic textbook. Chronic constipation is not discussed in very detail in the modern medicine books. Yes, they have described it, no doubt. And what they have described, chronic constipation is called by the modern medical people as habitual constipation. Habitual, सवयीचं झालंय त्याला. Habitual constipation is the word used by the modern physician. And they always blame only 3 or 4 factors. Of course, they are very important causes. I am not opposed for those causes, but they are not the only causes. They are not the only causes. What causes they talk about? Number 1, green leafy vegetables not eating. And they advise eat green leafy vegetables or fiber food. Fiber. Fruits, not juice. Fruits. Fresh, orange, mosambi, pomegranate, peru, guava. Eat fruits, safarchanda, apples. They ask to eat the fruits, green leafy vegetables. Number 2, because they say that you are lacking with this fiber. Second, they talk about the water. They always ask enough water. Drink enough water. Because the dryness is causing the constipation. Ayurveda is also saying the same thing. If you drink less water, that can cause the constipation. Third, they say, which is very, very similar to the Ayurvedic concept, don't suppress the natural urge. Don't suppress the natural urge of defecation. Ayurveda says, na vegan dharayet. This is the topic very well described by Ayurveda. Vega is a natural urge. Vega is a natural instinct, natural urge. And they have developed nearly 13 to 14 Ayurveda is described. Vata, Vind, Mutra, Kshavat, Trutchudam, Nidra, Kasa, Shramashvasa, Jarambashru, Chardiretasam. 13 Vegas are described by Vagbhat. What Vagbhat saying? Na Vegana Dharayet. Which? Vata, Mutra, Kshava, Trut, Kshudam, Nidra, Kasa, Shrama, Shvasa, Jurumbashru, Chardiretasam. Chardi and Retasam. So totally there are 13 natural instincts. Amongst that is a defecation. Many times this happens, especially when lot of people are living in a one crowded place and there is only one toilet facility. This happened in the Jhopadpatti area, slum areas. Previously it was happening in the Bombay Char. In the Mumbai city, there was a small houses, and for 10 houses, they had only one toilet. Sandas, only one. For 10 families. And each family member have nearly 3-4. And there I used to see the queue of the people to go to the toilet. So naturally, 20th people has to bear his stools for nearly 20-30 minutes. So every time it goes on, what will happen? It's a Vega Dharana, suppressing the natural urges. And what is happening for that matter? That makes the problem of your muscle tone. Your muscle tone gets disturbed. It is get the faulty training, wrong training. It should have the normal movement because it is a natural instinct coming from the brain to your neurological center. Sphincter should be opened when there is a fullness of the rectum. But as the God has given you the power that you can hold the external sphincter, this is actually the facility given for emergency. God has very, what you can say, sympathetic. He is a courtesy. Okay, don't worry. I will, what you save your izzat. So don't worry. You will not get in public, you will not get the stools. You can control your external sphincter. But that benefit is the people are getting the undue advantage. Okay, I have the power, I will hold it. I have the power, I will hold it. And one day the God makes his power. You are doing the 100 times mistakes. No, bhog ata tujha karmachi phale. You will suffer from the constipation. Very natural law. Bhagwan Krishna has told in Bhagavad Gita that I can give the 100 times excuses, but on 1 and 101 I will shoot you. Similar is the case here. Constipation cases, if the person is making the same mistakes again and again, that is not correct regarding the natural urges. Then lack of exercise is one of the very important concept in modern as well as in Ayurveda, because Ayurveda says muscles should be trained with proper vyayama in Ayurveda. So vyayama concept is not only for whole body concept, but vyayama of different organ is also understood by Ayurveda. In yoga especially, if you remember, there is a tratak. You have to look at the candle, then blinking of the eyes. So there are a lot of exercises that are described in the even simple Surya Namaskar, for example. What is Surya Namaskar? They are nothing but the exercise for your chest and abdomen, according to me. Yoga exercises are not meant for your bicep and tricep or the hamstrings and the gluteus. Remember my words. Yoga exercises are not for your bicep, tricep, hamstrings, but they are only for your chest and abdomen. Because especially Surya Namaskar, sun salutation, it is always compressing, relaxing, compressing, relaxing. When you bend any organ and get it back again, there is according to physiological terms, flexion and extension, compression and relaxation. Pump, it's like a pump. Yoga exercises give the good pumping to my lungs, to my heart, to my stomach, to my intestine. Pumping action. What is the benefit of pumping? When you do any pumping, it gives a natural flow of the blood. So when the blood circulation increases, you get the nutrients proper and waste product is also drained. In Ayurvedic language, you make your Srotasa function perfect because of this normal contraction and relaxation of the pumping. You are improving the quality, tone of the Srotasa in Ayurvedic concept. So that's why in constipation, general exercise, but especially abdominal exercises are very important, and one of the best yoga posture, two I will recommend for the constipation patient: sun salutation every day, 12 sun salutation on empty stomach in the morning, number one. Ask the constipation patient to do the sun salutation and see the effect. And second, Pavana Muktasana. Pavana Muktasana. On the YouTube, Professor Deshpande has given you also this training of yoga postures. So ask your patient to open that video clip and see how the Pavana Muktasana is done. 7 steps position is there. Someday I will also tell you over here. Then another important aspect which is not directly mentioned in Ayurveda is the specific side effects of the drugs, especially modern drugs. And when I talk about the iron and some antacids, they can give you the constipation. So in history taking, you must ask on which particular drugs the patient is having, and then you have to find out, is there any drug which is causing the constipation. And when I am talking about the habitual constipation, which I am describing in more detail with the Ayurvedic aspect, but before that, from modern perspective, I want to warn the Ayurvedic people also, especially young Ayurvedic doctors or the students of the internees and last year. They should not forget one important phenomena which we can see in the practice. There is an elderly patient, 45 above, 45 plus, 50 plus. He is complaining you, rather his son is complaining you, my father is getting always a problem of constipation. But when you ask detail, he said, it is not always, sometimes he get also loose motions. And some days he is also having the hard stools, very hard. Any other? No, very rarely he has also passing little bit blood. He is red. Then you should be very, very cautious. Any elderly patient with alternate diarrhea and constipation, alternate loose motion and constipation with PR bleeding, even once or twice time, you immediately refer to the anorectal surgeon for sigmoidoscopy to rule out rectal or colonic cancer. Remember my words, rectal and colonic cancer can be diagnosed, spot diagnosis, alternate diarrhea and constipation with PR bleeding. Then Ayurvedic Vaidya should not make a trial and error. They first, of course it may be the normal, but first go do the sigmoidoscopy, come back with the report and rule out there is no rectal cancer, there is no colonic cancer. Then you whatever you want, you Isabgol, Avipattikar Churna, Triphala, Basti, whatever you want. But don't take risk in elderly patient with alternate diarrhea and constipation and PR bleeding. Is it clear, this topic? Now, I am going into the detail about Ayurvedic aspect. What are the causes? Basically, constipation is a hard stool, but another criteria, according to Ayurveda, I am adding that unsatisfactory stool is also called as according to Ayurveda. Unsatisfactory stool, that means when I go to the morning, I not get my proper total evacuation is not happened. There is something has remained. And whole day I am feeling that something is there in my rectum, in my anus. That is also included according to Ayurveda in Malavastambha. Because we have the clear-cut idea. Malavastambha, hard stool. Malavastambha, scabella, like the goat's shit. It's not all the time that much hard. Unsatisfactory is also important feature of the Malavastambha constipation. Unsatisfaction. What are the causes? Make a list. Number 1, Vishama Ashana. You are not following the Ayurvedic rules of eating. Overeating is there. Viruddha Ashana, incompatible food stuff. Famous examples of Ayurveda is a milk shake. Banana and milk, that is a shikran. Rice, milk and adding little bit salt. Eating curd at night. Eating hot chutney of garlic in the summer season. Eating chocolates and ice cream in this rainy season. So these are all the incompatible, viruddha ashana, incompatible food stuff. Then adhyashana, excessive eating, habit of excessive eating beyond his capacity. There is no rule for all. Ayurveda says these all rules are based on your constitution, on your biotype. Pitta people, they have to eat 4 or 5 times because they cannot tolerate the hunger. Kapha prakriti, they have the mandagni, kapha biotype. So if they don't have the food hunger, don't eat it. Especially in the German people, I have to use this phrase. They in tradition, everybody is taking breakfast, huge breakfast, everybody. If I ask them, is it that do you get real hunger? The first answer is, we don't know what is hunger. We don't know what is hunger. At 8 o'clock, our hotel keeps the ready that breakfast, we go eat, that finish. At 1 o'clock, lunchtime, we go eat, finish. They don't know hunger. Then I used to make experiments with these German people. I asked them, everybody, if this type of answer is there. Now you do one thing. For next 2 days, don't take any breakfast and come to me at 12 o'clock and tell me what is happening. So some people come to me and say, Doctor, I feel little bit uncertain in my abdomen, little bit burning in my abdomen, little bit retrosternal burning, little bit headache. Then I say, no, from tomorrow you start eating. Some other people, they come to me and say, no, I am feeling good, doctor, no problem. I don't take any breakfast since last 3 days, as you said me. I made an experiment. Then what's your problem? No problem, doctor. Absolute right. Then I said, stop breakfast. Because that people is definitely kapha predominant biotype. Another person was pitta predominant biotype. So they have to make these experiments because they don't bother about the sensations. So Ayurveda has given the importance. Eat as per your capacity and at proper time. So Ayurveda's Ahara Vidhi Visheshayatana. This topic is such an important, globally important topic of Ayurveda. If somebody asks me, give me the list of the topics which are important worldwide. So I will give the top 10. This Ahara Vidhi Visheshayatana. Prakriti, Karana, Sanyoga, Rashi, Desha, Kala, Upayoga, Samstha, Upayokta. Of course, my lecture is not meant for that. So, but in simple language, for non-Ayurvedic people, I will say, there are specific rules and regulations of eating that everybody should follow. Otherwise, he will suffer from Agnimandya, or Ajirna, or Grahani, or Atisar, or Pravahika, or Malavastambha or constipation. So, according to Ayurvedic language, Vishamashan is a cause, Adhyashana is a cause, Guru, Laghu and Ruksha, excessive, heavy, all the time sweets, all the time fried food. That is a burden. That is a burden to your digestive juices, enzymes. Then apakva ahara, raw sarabhag, raw kitta bhag is there. In Ayurveda it is called undigested part, is called as a ama. So because of ama, there is a possibility of stool will not be satisfactory. That stool always becomes sthana. The person will get the defecation, no doubt, but he will be not satisfied. Why? Because of the two reasons. It is always sticky. Sama mala is a sthana that is sticky. He has to flush the toilets 10 times, Indian toilets. Lot of water will require to flush the stools because they will be all stick to the pot. Then when he wash with the hands, this is very, what you can say, the whimsical or abnormal according to the German people. When I say I can wash with my hands, that stool cleaning, they don't agree. Oh, no. We always use the paper. Now try to understand the quality of the paper, the nature of the paper and nature of our hand, which is soft and which is rough. You are already constipated, Ruksha Guna is there, and still more Rukshata, so you will suffer from fissure, you will suffer from abscess. Use the water for cleaning as per Ayurvedic say. Now these points can be debatable when the people will hear on the YouTube. But okay, I will talk with them when they concern with me personally. But this is very interesting finding based on my European experiences. So water using is very much essential. Then Laghu, there is a craze in the young people, especially the ladies. They want the zero figure. You know this word, zero figure? Everybody wants to make the slim, very slim. And losing weight, excessive dieting can be the cause of constipation. Remember, who can do the fasting? Kapha predominant prakriti. Yes, they can do the fasting. But basically you are dry. Your skin is dry. Your eyes are dry. You have the hands and feet fissure. You are always having the loose weight, a little bit on the lower side of the weight. Why you are doing the fasting? No. Then there is a problem of spiritual, adhyatmic, religious fasting. आज मारुतीचा उपवास शनिवार, आज देवीचा उपवास मंगळवार, आज दत्ताचा उपवास. Every day there is a God. So every time the people have the reasoning. No, because of that God I am doing fasting. I am not saying fasting is bad. Rather Ayurveda says langan is the best. But who should do the langan? The person who is already constipated should not do the langan. That is contraindication. Constipation is a contraindication for fasting. Rather he should eat sufficient quantity of food with water, with beverages at 4 or 5 times. That is the ideal solution. So ati guru, ati lagu, ati ruksha. Then vihara. Ayurveda says the causes, ahara causes, vihara causes. What is vihara? Ratri jagaran. That means going to the bed late at night. Night duty is one of the important cause of constipation. I am talking about vata predominant prakriti. Kapha predominant may not get the constipation. But vata predominant person, if he does the night shift, definitely he will be trouble. Call centers, hospitals, observe these things. Or any other normal person also. They are having the habit, TV, book reading, WhatsApp, Facebook, 10, 11, 12, midnight, 1, 2. Happy birthday, dot at 12:30 at midnight. People are very crazy, huh? I am the first person who wishes him. Dot at 12 o'clock. But you have to stay at night, 12 o'clock. Okay, one day I accept, no problem. You can enjoy one day. But many people have made the habit because of this media, because of the social networking. Many IT people, they do their jobs at night also. So this is something the cause of constipation. Ratri jagarana. Second is very wrong. Diva swap. Some housewives, they also made this habit. In the morning, very fast, they get up in the morning, do all the normal rituals, preparing the tiffin for their husband, for their children, send them to the offices, send them to the schools, and then they are happy. Whole afternoon is my afternoon. Housewives, they are very happy. And there is no job, there is no work. Everything is all right, perfect. There is the housemaid are there, nokar chakar. What they can do the business? They have only one business, sleeping. Then they make a habit to their body, immediate eating something and go to the bed for 3-4 hours minimum. Swargananda, Ananda. Very happy, comfortable. And they say, this is my life. Enjoying life. Start suffering from constipation, they understood, oh my God, this is also the problem, sleeping. Ayurveda believes only in the summer season, very hot season, Grishma Rutu, you are allowed to sleep a little bit. 1 or 2 hours or maximum 1 hour afternoon nap, NAP is allowed. But in all other seasons, when there is raining, when there is a cloudy atmosphere is there, very cold atmosphere is there, no necessary to sleep. You can take rest in the chair, you can move here and there little bit, Chatapauli, you can read something, make some business, Shivan Kam hai, sieving, make some hobbies and try to spend the hours. But sleeping, spending the time in sleeping is not good for constipation. This is an important thing. Ati Vyayama. No Vyayama, absolute no exercise is bad, but excessive exercise, especially for Vata predominant Prakriti, aerobics, new techniques are coming, Vyayama. What is Zumba dance something? What is that? I forget. You know that word? There is a specific dancing exercise on the basis of that Zumba or what? What is that dance? Huh? Yes? No. That is the European. No. Like something Zumba or something, the word is there. So you go and search that word. Many HMC people are not crazy for this type of the dances to make an exercise. But that excessive for the Vata is a bad. Ati yana, traveling excessively. All these causes make the ruksha guna, dryness is increased in your body, and that is the problem for constipation. In Vihara there is manasik, psychological problems, especially any type of the tension, family tension, occupational tension, economical tension. These tensions, anxiety, depression also can be the cause of constipation. Remember. Or even excessive workaholic, like your normal alcohol. Work is like alcohol. Some people are workaholics. That workaholics also can suffer from constipation because they don't enjoy even the defecation. I am saying that defecation is also one of the interesting process that one should enjoy. But people are enjoying in reading the paper during the defecation. So they can't get the stools, no? Because they are enjoying the paper. God is saying you enjoy the stools. But he is enjoying the smoking. So how you will get the stools? Yes, I know that some people are there, unless and until they smoke, they can't get the stools at down. So what is the relation? I don't understand. Is the pranavayu or apanvayu? I don't know. But this is very crazy. So don't go for that matter. Anyway, Ayurveda says even the straining is one of the feature of the constipation. Pravahana. Then little or no stool, very painful defecation, and in addition to that, there are a lot of symptoms mentioned in Ayurveda. Admana. Admana is a bulging of the abdomen, gas in the abdomen. Atope, excessive peristalsis, gurgling sound, excessive gurgling sound. Rullasa, nausea. Udarashula, abdominal spasmodic pain. Then udara dah, sometimes there may be acidity type of acidity developed from the indigestion. Amlodgar, sour eructations. Urovidah, retrosternal burning. Shirashula, headache. Utsah hani, loss of energy. You don't have any energy to work. Alasya, laziness. Swabhav, chidchida banne, excessive irritation of your mind. Even some people suffer from the insomnia, nidra nash. And another interesting thing, because of the circulating armor, these people get a lot of dreams. Excessive dreams in the sleep can be the feature of even Malavastambha. Very surprising to hear, but it is a fact. You have to make a research on it, whether the constipated patient gets a lot of dreams because of the armor. And complications are sure. One of the complications of Malavastambha is piles, hemorrhoids, parikartika, fissure in ano, gudabhransha, prolapse of the rectum, antravruddhi in Ayurveda, that is hernia, inguinal hernia, diaphragmatic hernia. There are two types of the avastambha or constipation. Vata pradhana, number 1, and Vata kapha pradhana. Vata pradhan, predominant Vata pathology is there. And Vata kapha pradhan, both Vata and kapha dosha are involved. What are the features? In Vata pradhan, there is absolutely dry stools, hard stools, pain in abdomen is much more, adman will be there, pravahana, straining will be there in Vata pradhana. In Vata kapha pradhana, there will be sticky stools. Remember, sticky. Straining will be more because of the stickiness. There will be kshuddha mandya in Vata kapha. Kshuddha mandya, anorexia. Mukha praseka, excessive salivation in the mouth. Mukha praseka, lalastrav. Tylism. Mukha daurgandhya. There will be foul smell to your mouth because of the Vata kapha Malavastambha. Stomatitis, aphthous ulcers, Mukha Paka in Ayurveda. Then, about the prognosis, acute for few days, few weeks duration, it is Sukha Sadhya. But when it is neglected as a minor problem, and when it becomes a year's problem, then it is a Kashta Sadhya. Very difficult to cure. First Sukha Sadhya, then Kashta Sadhya. When this problem arises in the old age, after 50, after 60, that is Kashta Sadhya or Yapya. that means the patient is following your advice, he will get the stool. He stops the advice of diet, of behavior, he will lose the he will again start the recurrence is common in the old age, Vardhakya. Most important rule to treat the constipation, Malavastambha, never use strong purgatives. Never use for treating habitual constipation. Don't use the Ichha Bhedi, Naracharasa, Virechana Kalpas, never. Vata Pradhana constipation, you have to use soft Mrudu Virechana. Soft Mrudu Virechana. Gandharva Haritaki Churna. Haritaki is a laxative and Gandharva is a erenda, resinous oil. So powder of the Haritaki is fried on castor oil or resinous oil, and that is called as a Gandharva Haritaki Churna. It's a combination of laxative and softness or the lubrication. That is important in Vata Pradhana. Second, in Anulomaka Dravyas there is a Bahava. So you can get the fresh Bahava Magaj fant or decoction or ready-made Aragvadharishta. 4 teaspoon with 4 teaspoon of water 2 times in a day. Aragvadharishta for Vata Pradhana Samprapti, pathogenesis. Nishottar or Trivrut. So Trivrut Kalka is available. Trivrut Leha is also available. 1 spoon every day. Draksha, that is the resins, R-A-I-S-I-N-S, resins. Manuka in Marathi, Draksha. In market, Draksharishta is available. Draksha Sava is also available. And simple thing, you must advise the patient, if he is not diabetic, minimum 10 to 15 or 20 resins after washing in the morning, in the afternoon, in the evening. Eat lot of manuka. Manuka kha, kai nuksan nahi hai. It's a food, it's a diet. So every constipated patient should be asked to eat manuka, resins, black resins. Then at night, as I have already told you, 1 cup of the warm milk plus 2 spoons of ghee, cow's ghee. Even simple shengdana tel or groundnut oil also can be used. If the patient is strong enough to take that oily sensation, 1 cup of simple warm water and 2 spoons of shengdana tel, groundnut oil, simple. We are using in Maharashtra for cooking that our food. So shengdana oil, groundnut oil also can be given to the constipated patient, Vata Pradhan Samprapti. Patient is of Vata. Then Vata Kapha Pradhana Malavastambha. Stickiness is there. Simple thing, Matra Basti, to apply the sesame oil around his umbilical region, clockwise, very soft massage, and then fomentation. Every day before his bath. This is a very simple remedy. So thank you very much for your nice and patient hearing. I wish you all the best, and I request all of you to continue my YouTube subscription and share this audio video to as much as possible to the interested people. Thank you.